Hi, my name is Dr. Cozy. It's really nice to meet you. Really quickly off the bat, can I just have you verify for me your name and date of birth? Perfect, thank you. Okay. Okay, I see that you're here because you've been experiencing some chronic vertigo after having an ear infection. Okay, can you tell me a bit about that? Okay. And did the physician that treated you, did they start you on any antibiotics at all? Okay. And after you finished that dose, how did you feel? Did you feel like there was any kind of relief of your symptoms for a while? Okay. So it started a few days after. Okay. Is the vertigo worse in different positions? For example, lying down, or if you turn your head in a specific direction? Okay. Any ringing in your ears or whooshing sounds? How about any crackling or popping when you swallow? Any nasal congestion, sore throat? Any ear pain? And how about, are you experiencing any kind of hearing loss at all? Okay, it says here that the physician that referred you also had you using some nasal spray. Are you still using that? Okay, are you finding it helping at all? Not for this, okay. Give me one moment, I just need to grab something. Just needed to grab some headphones because we will be doing a hearing test. But that can wait for right now. So, okay. Going to start by examining the anatomy of your ears, both internally and externally. I'm also going to be examining your throat, your sinuses as well. Looking for any kind of inflammation or anything that might be a contributing factor. So, is it okay with you if I touch you? Thank you. Okay. So we're going to start looking at the external ear. Let me know if anything is uncomfortable. Just feeling the parotid glands as well as the area where we can palpate these station tubes where they drain into the throat. A little tender, okay. That's not too alarming after having recently gotten over ear infection. Not feeling anything alarming externally. Now let's take a look at the insides of your ears. Okay. Oh, I'm going to do something. Not over there, let's see. There we go. Called insufflation, where I'm going to be blowing some little puffs of air inside of your ears. I'm checking the mobility of your eardrums, making sure that they move in response to the air, okay? Okay. Now you're going to feel two things going into your ear now. Check the other side now as well. So. One last thing, actually two. I just want to take a look inside of your nostrils. So, right, nice and clear. Can I have you open for me? Great. Okay. Close. And then just look straight ahead, right in between my eyebrows. Let's turn that up a little. Okay. So as far as I can tell, your eardrums are quite mobile, but there's only so much I'm really able to see just using an otoscope. So in just a moment we're going to do some more detailed testing. But first we got one more thing we need to do. Two more things. I keep saying one, but really there's two. Going to do a Nystagmus test, which is likely going to trigger your vertigo. What I'm looking for is a certain kind of flickering in your eyes, which indicates that you're feeling off balance. I'm looking to see if that's particularly more prevalent in one direction or one certain movement than another, okay? Okay, so bear with me. I'm going to place both sides, or both of my hands on either side of your face. And we're going to start with small movement. So you ready? Okay. And just a little movement here. Okay. All right. I'm going to make that a little bigger. So I am seeing it pretty constantly throughout the range of motion here. Feeling pretty dizzy, I'm sorry. Okay. Okay. One more thing we're going to do, which is conduct a hearing test. This is a beep test. You may be familiar with this from when you were a kid. I'm going to be putting some headphones over your ears, and as soon as I start my program, you're going to hear a series of beeps. I'd like you to raise the hand that corresponds with the side you heard the beep on, okay? Okay. These should be pretty comfortable. These are very soft and flexible. So, it should be starting in just a second here. There we go. Okay. We're all done there. I'm just going to take this from you. Okay. So you got all of those correct. So that's good. So we're going to do something called tympanometry testing. We're going to do this to rule out anything like a eustachian tube dysfunction, fluid buildup in the ears, something called otosclerosis, any kind of fistula, which would be like a hole in the ear canal, things like that. What's going to happen is I'm going to be inserting this probe very superficially in the ear. It's going to play a tone, and you'll also experience some pressure changes. And that's going to help us read and determine if there are any of these issues occurring in either or both of your ears. Okay? Okay. Let me just boot this up. Okay. And we will start with your left ear. Okay. So, right. So, it might be a little bit tickly, and I apologize for that. Okay. Going to switch to the other ear now. So that actually came up negative. Okay, I'm going to repeat our Nystagmus test where I was turning your head. However, this time I'm going to do it a little bit faster, okay? Part of that is to help further diagnosis. The other part is to see if that actually helps with sort of realigning some things, and I'll tell you why in just a moment. So, I'm going to place my hands again on either side of your head. Okay, and is that okay? Okay. Where did that go? Okay, take another look inside of your ears. Open your mouth for me again, please. Thank you. Okay. And just stare right in between my eyebrows again. just wanted to see if we had potentially loosened up any kind of fluid, or if that head turning caused any kind of changes that might give us some kind of hint if there is an issue in the inner ear, but I'm not seeing anything. So since the Nystagmus testing did not produce any kind of changes and the tympanometry exam did not give us any kind of definitive answers, I think what we have going on here is something called benign paroxysmal positional vertigo. And basically what that means is that everyone has these little crystals in their ears. Okay, they're called otoconia. And their job is to kind of float in the fluid that's inside to help us maintain our balance. Sometimes, especially if we've had an ear infection and we've been blowing our nose hard, lots of coughing, things like that, they can get dislodged, and that balance, that fluid balance, gets disrupted, and that's what creates vertigo. In our practice, we don't like to treat that with medication, at least not at first. What we actually have you do is some physical therapy, the Epley maneuver in particular. And we do have an in-office physical therapist whom I will have come in here and perform that with you as soon as we are done. You will need to practice this multiple times a day over the next few days. It is not just a one-time fix. If after a week you're still experiencing the vertigo, it's not changing, it's not lessening at all, then I want you to come back in so we can reevaluate, okay? Okay. Usually this is pretty successful, but every now and then we do end up having to look a little bit deeper. So let me just write a quick order. So I'm going to step out and let our physical therapist know that their presence is needed in this room, okay? So it should just be a couple of minutes. Do you have any questions for me before I step out? Okay. I will be giving you a call in about 2 to 3 days to check in and see how you're doing. So if you do happen to think of any questions, you can ask me at that time, or you can give me a call, okay? Even if I'm not available, just leave a message with the front desk staff or with our answering service, and I will give you a call back as soon as I get the message. All right? Okay. So, you just sit tight, and our physical therapist will be in just a moment.